So let's preface this real quick. We're going to be doing our doctor's report day 2, so we would have already had the patient's x-ray, fluoride, and all that stuff. So this is kind of how we're acting it out, as if we've already done that. Okay? So my name's Randy Kulig.
I'm Sam Wyman.
Okay, so we're going to present you with our health talk today. But before we get into that, I wanted to kind of give you a background about how I got into chiropractic. So I've been going to a chiropractor my entire life. And I remember when I was young, going to my chiropractor, seeing all the spine models and all the x-rays on the wall, and thinking to myself, man, this is really cool. I want to be a chiropractor when I grow up. So throughout grade school, anytime anyone would ask me, what do I want to do, I would say I want to be a chiropractor. Even though in the back of my mind, I really didn't know exactly what chiropractic was. So when I graduated high school, I went to undergrad, and at the same time I worked for a bank. And I really loved banking. I loved the numbers, I loved working one-on-one with clients, everything just kind of seemed to flow naturally for me. And so by the time I graduated undergrad, I got promoted, and I had a really tough decision to make. A decision that we all have to make at some point in our lives. One of the toughest decisions of our entire lives. What am I going to do for the rest of my life? So, before committing 3.5 years to chiropractic school, without really knowing much about chiropractic, I wanted to do some research, so I started where anyone would start, the internet. Unfortunately, on the internet, what I found was a lot more negatives than positives about chiropractic. I found things like chiropractic has no science behind it, chiropractic doesn't help people, and chiropractic doesn't work. So then I went to my second source. I went to my chiropractor that I had been going to my entire life. And I went in there all excited and said, guess what? I'm thinking about quitting my job and going to chiropractic school to be a chiropractor. What do you think? And her response is something I'll never forget. She told me, if you go to chiropractic school and quit your job, it'll be the worst decision that you ever made your entire life. So I was kind of taken back by that response, but after a few more weeks of researching and kind of contemplating, I decided to go to chiropractic school anyway. And ever since I've been in chiropractic school, as each day goes by, my love and my passion for chiropractic continue to grow. See, the internet was wrong. Chiropractic is one of the most scientifically sound professions that we have. Chiropractic has helped millions of people, and chiropractic definitely works. And my chiropractor was also wrong, because going to chiropractic school was one of the best decisions of my entire life. See, I went 24 years without knowing the true meaning of what chiropractic actually was. That's why it's our goal today to make sure that you don't go another day without knowing what chiropractic is and what it can do to change your life. So I'm going to turn it over to Sam, and he's going to start with what our healthcare system is like today. And throughout the entire presentation, we're just going to kind of be switching out, okay?
Thank you, Randy. That was a good intro. So, according to the CDC, almost 50% of the population has been on at least one prescription drug in the last 30 days. Almost 1/4 of the population has been on 3 or more prescription drugs in the last month. In addition to that, we spend the 3rd most amount of money per capita on healthcare when compared to any other country in the world. So, with that being said, where do you guys think we rank in life expectancy? How many do you think top 3?
Woo!
Yeah. How many do you think top 5? I like it. How many do you think at least top 20? At least, right? We spend all that money on healthcare, yet we rank 31st when compared to other countries.
Whoa.
Now see, some estimates show that the United States makes up 7% of the world's population, yet we consume on the upwards of 75% of the world's prescription in all areas of overall health when compared to other industrialized nations. So what leads us to consume all these medications? See, the United States is one of the most stressed countries in the world, and we consume these medications to help deal with those daily stressors. For example, you had a long day at work, you come home, but you work in sales, so you can't stop working. You can't go to sleep, so you have to take an Advil PM. Another example, you're picking up your kids from soccer practice, and you're stuck in Atlanta traffic. We've all seen this picture before. Now the kids are in the back fighting, you have a throbbing headache, so you take a Tylenol. Those are just a couple examples. But those everyday stressors are what leads us to the unhealthy habits of living off medication. Now, those are just a couple examples again, but why do we rank so poorly in overall healthcare? It's because the system that we have focuses primarily on symptoms. Now, a patient's going to walk in with his symptoms and they're prescribed a medication for that, and a lot of times it's going to get that symptom to go away. But it doesn't necessarily address the cause to why that symptom was there in the first place. Now, a good example of that is with high blood pressure. So a patient has high blood pressure, walks in, they get a blood pressure medication, and guess what? It's going to lower that blood pressure. Does that mean that it addressed what's causing that blood pressure to be there in the first place? Does that sound good to you? No. You see, when the cause to this symptoms is left unaddressed, that's going to lead to chronic disease. And in this case, it could lead to heart disease. Heart disease is the #1 deadliest disease that plagues our country. And in fact, of the top 10 diseases that plague our country, 6 of them are a result of chronic disease. So you think a healthcare system that bases primarily on symptoms is a good system for overall health?
No.
No, I don't think so. So wouldn't it be great if there was a system out there that focused not only on your symptoms and allowing you to feel good, but also on the cause and allowing you to function great at all times? See, what a lot of people don't know, and what the healthcare system doesn't focus on, is that our bodies have the ability to heal. Our bodies have the ability to adapt and stay healthy when adapting to our environment and the stressors that come with it. In chiropractic, we study the function of the human body, how it should function, what keeps it from functioning, and how to keep it functioning optimally at all times. But to understand that, we must first understand how our body functions.
All right. So let's talk a little bit about how your body functions. So every function of your body is controlled by the nervous system. The nervous system is the master control system in your body. If your nervous system is functioning properly, the rest of your body will function properly as well. Thus, maintaining a healthy nervous system is extremely important. Your nervous system consists of your brain, your spinal cord, and your spinal nerves. Every thought, feeling, and action begins with your brain. Your brain then will send an electric signal down your spinal cord and out your spinal nerves. These spinal nerves act as pathways for your brain to communicate with the rest of your body and how to respond to those thoughts, feelings, and actions. Via these electrical signals that are sent from your brain, these spinal nerves supply every organ and every muscle in your entire body. These spinal nerves are responsible for your heart to beat, for your lungs to breathe, for your stomach to digest, and for every muscle in your body to move. Your nervous system is protected by the hardest, strongest, most durable bones in your entire body. Your brain is protected by your skull, and your spinal cord and spinal nerves are protected by your vertebra. As chiropractors, we specialize in correcting the vertebra. And so these vertebrae make up your spinal column, and there are 24 movable bones in your spinal column. However, it only takes one of those bones to be out of alignment in order to cause a downward spiral of your health. So what do I mean by out of alignment? Well, anytime that a bone gets out of its natural or normal position, causing dysfunctional movement, we refer to this as a misalignment in the spine. And misalignments can occur from a variety of ways, from anything such as a whiplash injury from a car accident, a fall, a sports injury, bad posture, and even the birthing process. From day one, when you're pulled out of your mother's womb by the doctor, putting that pressure on your skull, causing a misalignment from the day you were born. In fact, current research has shown that 90% of newborns have some type of trauma associated with cranial and neck strain. So think for a moment. How many traumas and injuries have you had throughout your life? And how are these traumas and injuries affecting you now? See, earlier I said that if just one bone in your spine is out of alignment, it could cause a downward spiral in health. So how does it do that? So, anytime there's a misalignment in the spine, the electrical signals that are sent from your brain to the rest of your bodies are affected. The two signals that are affected anytime you have a misalignment in the spine is one, nociception, which we're going to refer to as the N signal, and two is proprioception, which we're going to refer to as the P signal. Now, what do these signals do? The N signals are responsible for an increase in stress hormones and an increase in tissue destruction. So we're going to think of these N signals as negative signals. We want to minimize these signals as much as possible. And then the second signal is the P signal. The P signals are responsible for movement, coordination, balance, organ function, and immune function. We're going to think of these signals as positive signals. We want a lot of these signals. So what happens to these signals when there's a misalignment in the body? Well, what we know from scientific documentation is that when there's a misalignment in the spine, you have an increase in the N signals, or the negative signals, and a decrease in the P signals, positive signals. So when you have an increase in the N signals, it's going to lead to an increase in tissue destruction and an increase in stress hormones. When you have a decrease in the P signals, or the positive signals, it's going to lead to a decrease in your coordination, your movement, your balance, your organ function, and your immune system function. So if this cycle, the increase in P signals and the decrease in P signals, continues for a period of time from a misalignment in the spine, it's going to lead to increased joint dysfunction, increased organ dysfunction, increased immune system dysfunction, which is ultimately going to lead to sickness, disease, muscle degeneration, and pain. So these are just some of the symptoms that may arise from a bony misalignment in the spine. Okay? So how does one bone that's out of alignment lead to all of these problems? Well, do you guys remember those old holiday lights? The holiday lights that if one light was out, the rest of the lights in that entire strand would be out as well? So you'd have to go through those holiday lights, twisting them, trying to put them back in, finding which light is the problem light. And see, the reason that if one light was out, the rest of the strand would be out is because they share the same power circuit. So when you found that light that was dysfunctional and corrected that light that was dysfunctional, the entire strand would light up again. So your spinal column works in a similar fashion. If one of your vertebrae are out of alignment, it's going to cause dysfunction in the entire spinal column and also dysfunction of the power source of your spine, which is your nervous system. So what our goal is to go in there, just like the light bulbs are representing the vertebrae. So we're going to go in there and we're going to find which vertebra is out of alignment, just like we found which light wasn't working. We realign that vertebra, restoring health to the spinal column and to the power source, the nervous system. Does that make sense? So how do we correct these misalignments? I'm going to let Sam talk to you guys a little bit about that.
In chiropractic, our goal is to correct the structure and the function of the spine by gently realigning it to its proper position. This is going to normalize the signals that Randy just talked about. Now this is a model of the spine. From straight ahead, it's supposed to be straight up and down. From the side, it should have these three curves. How many of you guys think this is a healthy spine? No? So how are you going to correct it? You're going to take a medication? And if you take a medication, that's going to get rid of the pain that's there because it's a symptom. But is it going to correct the structure? No. And over time, that pain is going to come back. So then what do? So when left in this position long enough, stress builds up and these bones begin to degenerate. That can lead to inflammation, irritation, and hyperactivity of those nerves, further increasing the pain, and also further making the signals going to your brain not the way that they should be. So then, when left alone, left uncorrected, the next thing they do is they go in and they inject those nerves with a shot to kill them, and that gets rid of the pain for a while, but did it fix the structure? No. So as a last resort, they'll do surgery, cutting away the bone and the tissue to try to get rid of that pain once and for all. But see, those types of surgeries are very expensive, and a lot of times they fail and actually cause problems further up the spine and further down the spine. These are just a couple examples of what degeneration looks like and what some types of surgery may look like. So what is the only way to correct the structure of the spine without invasive surgery and costly surgery? What we do, we focus on the biomechanics of the spine, how it moves, and the structure of the spine. We restore the structure and function of your spine to what its normal is as best as possible, so that takes the stress off the nerves and it normalizes the signals that Randy was talking about. This allows you to experience true health. And the way that we go about doing that is a very specific and gentle adjustment to your spine, realigning it. And we have two phases of care in our office. We have corrective care and we have wellness care. And the reason is, by addressing the spine and preventing it from having degeneration in it, we can actually limit a great deal of pain and suffering. And that's why we focus on wellness care in addition to corrective care. You see, with corrective care, someone's going to come into our office, much like you guys have, with some type of complaint. And our goal is to get rid of that as fast as possible, right? But once that's accomplished, we're going to then begin wellness care. Wellness care has a goal of maintaining optimal spinal function, just like a dentist would take care of your teeth. Now see, you don't have to have a previous complaint to be under wellness care. Wellness care is good for kids. It's good for adults with no previous complaints that are feeling good. It's also even good for infants. The reason being is because having a healthy functioning spinal column can limit the need for future medication, costly surgery, and the pain and suffering dealing with chronic disease. Now Randy's going to go over what care looks like in our office.
Okay. I wish that was our office. That's nice. So there's a definite difference between the way chiropractors practice. In our office, our number one goal is to get you feeling better and functioning better as quickly as possible. We believe that as life progresses, so should chiropractic. So we have established a way to care for you that utilizes advanced technology in order to provide you with one of the most accurate chiropractic analyses in the world. So you might have wondered why we took an entire day to take x-rays and do all those diagnostic tests on you. See, we believe that chiropractic should be used with the same delicacy and laser-like precision as brain surgery. We take pride in performing an extensive and detailed analysis so that we're able to provide an individualized care plan specific to your needs. So the first thing we did was take an x-ray. We took a series of detailed images of your neck and your pelvis, and what we're looking for on these images is any misalignments. We also will use these images throughout your care to show you how your spine is progressing. The next thing we did was take video x-ray. We use this low radiation video x-ray to zero in on exactly where your problem is coming from. This machine allows us to see which part of your spine is moving and which part of your spine is not. The last thing we did was we took a few thermography scans on you. Thermography is a picture of your physiology, just like x-ray is a picture of your anatomy. we're able to see exactly how your nervous system is functioning and how those electrical signals are firing. It also allows us to, it also guides us to let us know when your body needs to be adjusted. See, we believe in chiropractic that an adjustment should be given only when it needs to be given, and we need the proof to show that your body needs that adjustment. And this is one of the tools that we use. So every time you come in, you're going to be getting scanned at least once, sometimes maybe twice. So we put all of these tools together as a system of analysis to determine when and where your body needs an adjustment. You might have noticed when we were going over all your diagnostic tests that we were really focusing in on the neck area. In our office, we specialize in correcting the area of the neck or the cervical spine. The cervical spine is the most movable area by far in your entire spine. It is also the most important area of your spine as it's the closest to your brain. We find that 96% of all spinal misalignments come from the neck. Believe it or not, even people with low back pain, their main problem is in their neck, thus corrected by adjusting the neck. So how do we adjust in our office? So our adjustments in our office are unlike traditional chiropractors. There's no twisting, cracking, or popping. Our adjustments are light forced. Maybe it doesn't look that light forced, but and very specific. We want to make sure that you feel comfortable when we're adjusting you and we're able to realign your spine to get you functioning optimally. So Sam's going to tell you about a case that he had with a patient.
So this is one of the patients that I had in the office. Now, this is a 48-year-old female with a complaint of neck pain, low back pain, fatigue, and a 20-year history of chronic headaches where she had had a headache every single day for over 20 years. And this is actually one of my first patients when I was a student. And interestingly enough, this patient was actually under previous chiropractic care. Now that chiropractor was delivering care and she would get symptomatic relief, but unfortunately he wasn't addressing the cause. He was able to help her, but he didn't have access to the tools and the technology that we have today in our office. And since I had access to that tool, those systems and those tools, the technology, I was able to get the spinal correction that you see here, with the red line being off here where her spine is and the yellow line where it should be, and with it perfectly centered there, because I had access to those tools. Now all her neck complaint decreased and got better, her low back pain got better, she had more energy, so fatigue improved. And the coolest thing was that her 20-year history of headaches every single day stopped after the first adjustment. And she was able to go for 3 months before having one again. And what makes this case very important to me is because this patient was actually my mom. Now, by taking the time to do all this testing that we've done, going over it, making sure that we know exactly what's the cause of your problem and if we can help you and how we can help you, is because we want to be able to deliver the best care to you so that you can get the best results and that we can make a lasting impact on your life.
So what we want you guys to take away from this lecture is that chiropractic is based on a scientifically proven hypothesis that proper structure of the spine will lead to proper function of the nervous system and overall health. It is our mission to provide you with specific, individualized chiropractic care in order to get you functioning to your optimum health potential. We're going to do whatever it takes to make sure that you walk out of our office in better health than you walked in with today.